Hello everybody, I'm Dr. Sergio Vañó-Galván. I'm a dermatologist from Madrid, Spain, and I'm the current secretary of the European Hair Research Society. And I'm the president of the World Congress for Hair Research in Madrid that will be held in 2028. During this European Academy of Dermatology and Venereology Congress in Paris, I was delighted to chair a session about hair disorders. It was an interesting session in which very good speakers talked about different types of alopecia. I gave a speech about Lichen Planopilaris. This is the most frequent cicatricial alopecia. We can interpret Lichen Planopilaris like the variant frontal fibrosing alopecia, which is the most frequent cicatricial alopecia in Spain and in many countries, and Lichen Planopilaris itself. We can even distinguish like a variant called fibrosing alopecia in a pattern distribution. They are not exactly patients with Lichen Planopilaris, but it can be misdiagnosed as Lichen Planopilaris. Summarizing the most important points of the lecture, in frontal fibrosing alopecia, we can say that we have established treatment with 5-alpha reductase inhibitors, mainly oral dutasteride. We use anti-inflammatory treatments, mainly topical calcineurin inhibitors, and it's like very trendy now to start prescribing topical JAK inhibitors, which have demonstrated to decrease the inflammation. And we also recommend the patient to take oral minoxidil just to improve the hair density of the non-damaged hair. I highlighted that we should not forget about the cosmetic advice because, for example, the eyebrows micropigmentation or other measures like oral isotretinoin if the patient has facial papules can really improve the quality of life of patients. And we discussed that hair transplantation can be also performed in selected patients. Regarding Lichen Planopilaris, the main treatment is the use of topical and intralesional steroids. And for severe patients, we can use oral cyclosporin or even oral antimalarials. And of course, we also can prescribe oral minoxidil and use other cosmetic measures like keratin microfibers. I want to sum up saying that in the field of hair disorders, we are living a great period now with the use of new drugs like JAK inhibitors for alopecia areata, new treatments that have been established in the last years, like oral minoxidil for androgenetic alopecia or mesotherapy with dutasteride. So I think that the hair research is really active and we can offer different therapies for our patients. I want to send a very special invitation to all Chinese dermatologists who we admire a lot. And you will be really welcome to our World Congress of Hair Research that we will hold in Madrid in May 2028. So you all are invited to our Congress.